there are thousands of children aged 7 and 14 who were in the compulsory schooling age group who have been lost to the system. Now, the advisor to the Department of Basic Education, Professor Martin Gustavsen, says that the number of learners is not as large as was previously reported by the National Income Dynamics Study Coronavirus Rapid Mobile Survey. Now, this survey had suggested that over 500,000 pupils have not attended school due to COVID-19. For more on this, we are joined now by the professor, Professor Gustavsen, who is going to talk to us about this particular matter. Prof, thank you very much for your time. So, if the figure does not sit at 500,000, where exactly does it sit?
Good morning, Chloe, and to your viewers. We have a problem. We need to look very carefully at the data. I think NIDS-CRAM, the NIDS-CRAM analysts did as good a job as they could with the data they have. Remember, they are using telephonic survey data. This is now somebody from a household getting a call saying, like, have children return to school. And we have a very confusing environment currently where children are attending some days and not others. So it's a bit of it can be a confusing question. But they arrived at about 500,000 fewer learners in school in 2021 relative to what we could expect were there no pandemic. Now, what myself and others have been doing is looking at the enrollment data in the Department of Basic Education, which has details on individual learners. It's very comprehensive data. And what this tells us is that, yes, there is a problem. For instance, there are 10,000 fewer children aged 7 to 14 in school than we would expect. There has been dropping out. But at least the enrollment figures point to a problem, but not of the magnitude of 500,000. But it's still a problem that one must deal with. And one must keep in mind that we're sitting in a very confusing kind of situation where you may have children who have enrolled at the start of the year. They won't have schooling available every day of the week for many learners. And some may then attend less than they should.
Prof, I'm going to press you a little bit on this. I know it's probably going to be difficult for you to give a definitive answer, but if it's not 500,000, then where does that number reside?
The number resides at about 30,000. We're looking at about 10,000 learners who seem to have dropped out, learners of the compulsory age band. And then and there's another problem, and that is children who should have started school in 2021, either in grade R or in grade 1, who have not appeared as we would expect it. And that is approximately 20,000. So we're looking at, maybe up to 30, 40,000 children fewer than what we would expect.
And the reasons, Prof, you possibly may have touched on them, but let's elucidate them some more. What are the reasons that these children are sitting at home?
Well, what we know is that the pandemic has not had high levels of mortality amongst children. So it's not as if we have fewer children. Mortality amongst children has remained more or less the same as in the past. But the reasons we can speculate. We are speculating, but we can be relatively certain that one is dealing with, number one, fears about sending children to school. The issue is not really homeschooling, because we are seeing these declines in poorer communities where one would not expect a lot of homeschooling to be happening, at least not in a formal sense in terms of policy. But then another factor would just be that many households have been traumatized by the pandemic. People have lost jobs. It's just maybe not their number one priority to get children back into school. It could also be the disruptions to the school feeding program. And this has been relatively well managed after initial teething problems, but if feeding school nutrition is not working as it should in certain schools, that would also discourage parents from sending their children.
If the reason, as you say then, Prof, that the primary reason could be fear on the part of parents, one, surely we should be more sympathetic towards them because they genuinely don't know what to expect after sending that child to school, because at home they may be sitting with someone who has comorbidities. But also the other element is what kind of messages need to go out there to reassure the parents, because unfortunately children that young, I don't know if there is going to come a stage where the vaccination program reaches them, but right now what we know is that it's not.
Yeah, there are messages that I think could be sent out more strongly. Two in particular. I think the one is that it needs to be emphasized and re-emphasized that children who are not attending school as they should, in particular children from poorer communities, are losing learning, and those losses are to some extent irrevocable. So we've reached a point where the learning losses are so large that what we can do is minimize the damage. But the more schooling that is lost, the greater the chance that children are just not going to cope with schooling. So there's often this idea that, well, if a child, loses some schooling now, we can catch up later. But the thing is that children's learning needs to occur at particular stages because of the brain development of children. They need to learn literacy, numeracy at particular stages. So that's the one thing that needs to come out clearly. And I think the other thing that needs to come out clearly is that there's no clear evidence that having children in school worsens transmission in communities. The research, the rigorous research from around the world that we have points to schools being open or closed making a very small difference or no difference to transmission in communities. So sometimes, there are cases where 50 learners in a school are infected, and that creates the impression that schools are kind of centers of infection. But children are interacting with each other outside of school as well. And there's a reason why then the World Health Organization, in its list of non-pharmaceutical interventions, things to do to limit transmissions, closing schools is somewhere right near the bottom of the list. Closing businesses is regarded as more important in terms of the WHO than closing schools. So I think it's important to send that message out that schooling is, from what we know so far, there's no clear, large effect causing more transmission when schools are open. At the same time, obviously we need to monitor things as we move towards normalization of attendance, because we're going to have to go back to daily attendance for learners. As we do that, we need to monitor things very, very closely, use the data that we have, and take action where we see that we are seeing transmission and it could be linked to schooling.
Professor Martin Gustavsen, he is an advisor to the Department of Basic Education. Thank you very much for your time.